Good morning. My name is Nelly. I'm going to be a nurse for today. Please perform the head to assessment on you. Alright. Could you please verify any date of birth for me?
Derek Nicole Williams, April 26, 1997.
Okay. I'll check armband. Okay. Do you know who the president of the United States is?
Biden.
How? Do you know where you're at today?
That hospital.
Do you know what we'll be doing today?
A physical assessment.
Okay. Do you know what today's date is?
May 2nd, 2024.
Okay. So from what I've assessed, the patient is AO times 4. Now moving on to general survey. From what I can see, the patient is calm. She looks appropriate for her age. She's not, her weight is appropriate. She's not too thin, not too obese. She's sitting upright. Her overall appearance looks good. She's dressed appropriately for the weather, and no signs of bad hygiene. Then now moving on to the skin. Assessing the skin, looking at the overall skin, I don't notice any cyanosis, no jaundice, no pallor. I'm going to assess the temperature, warm and dry. I'm going to assess skin turgor. Okay, her skin does not tense. I'm also going to assess the nails. Her nails are smooth, firm, pink. There are no cracks in between her fingers. I don't notice any clubbing. Everything looks normal with her nails. Capillary refill is less than 3 seconds for her nails. Now moving on to her head. Also assessing her hair as well. Her head is normocephalic. I don't see any bruising. I don't see any redness. Looking at her hair as well, her hair is evenly distributed. I don't see any lice. I don't see any visible masses, no lesions on her head. But before I proceed, have you had any trauma to your head?
No.
Are you experiencing any headaches?
No.
Any family history of headaches?
No.
Okay. Now I'm going to put on my gloves so that I can palpate her head. Is that okay with you? Okay. Palpating her scalp, feeling for any masses, lumps. None. I don't feel any. Everything looks normal. Now moving on to. Then I'll also palpate her temporomandibular joints. Could you bite down? Oh, open your mouth and close. Bite down on it. Okay. So from what I've assessed, cranial nerve 5, which is the trigeminal nerve, is intact. Now moving on to her eyes. Any trauma to your eye? Do you have any trouble with your vision?
No.
Any surgeries in your eye? Okay. Now, an inspection of the eye, I see that her eyes are even. They're equal. They're symmetrical on her face. I don't see any ptosis of her eyes. Her pupils are of equal size from what I can see. Now, I'm going to palpate to check her conjunctiva. Her conjunctiva is pink. I'm going to palpate her on her eyes. Do you feel any tenderness?
No.
I'm going to palpate her lacrimal.
Lacrimal sagged up.
Her lacrimal sac. No drainage. I can see that her eyebrows and her eyelashes are evenly distributed. Her sclera is white. Everything looks normal. Then I'm going to perform cranial nerve 2, which is the optic nerve, to set her vision. Okay. Could you please close one eye and breathe?
Just a moment. In God we trust.
Okay. Close the other eye, and then
In God we trust.
Then read with both of your eyes.
In God we trust.
Okay, now I'm going to check her peripheral vision.
Oh, sorry.
So if you could please look straight ahead, and then say now when you see my finger.
Now. Now.
Okay. From what I've assessed, cranial nerve 2 is intact. Now I'm going to assess for cranial nerves 3, 4, and 6. Look straight at my shirts. pupils constricted. Follow the direction of the spine lights with just your eyes.
Hey. Hey, my dog.
Hello.
Okay, so from what I've assessed, cranial nerves 3, 4, and 6 are intact. Now moving on to the ears. On inspection of her ears, I see that her ears are even on both sides. They're aligned properly. I don't see any no drainage from the ears. I don't see any redness of her ears. Now I'm going to palpate her ears. Do you feel any tenderness?
No.
Now before I proceed, have you had any trauma to your ear? Do you having any problems hearing?
No.
Do you get any drainage from your ears?
No.
Okay. Do you feel any tenderness around your ears?
No tenderness.
Okay. Now I'm going to look into her ears. Okay. Pull the pin up on the back. So from what I've assessed, her tympanic membrane is fairly gray, slightly concave. I don't see any drainage. I don't see any swelling of her ears, no perforated eardrums, no drainage. Everything looks pretty normal. Now I'm going to perform cranial nerves 8, which is the whisper test. So just close your eyes and repeat back what I whispered to you.
1, 2, 3. 1, 2, 3.
Okay. Then I would also perform the Renee and the Weber test to check for hair. So from what I've assessed, cranial nerve 8 is intact. Now moving on to the nose. Have you had any trauma to your nose?
No.
Do you any history of sinusitis? Are you able to breathe well from your nose? Okay. Now, on inspection of her nose is midline on her face. The skin around her nose is intact. I don't see any visible drainage, no redness, no, lesions around the nose. Now I'm going to palpate her sinuses. Going to palpate her sinus. Are you feeling tenderness? Are you feeling tenderness?
No.
Okay, now I'm going to look into your nose. Could you please tilt your head up? Okay. Her nose is moist and pink. No deviated septum, no perforated septum, no drainage, no swelling of the nose, no signs of any infection, which is normal. Now I'm going to perform cranial nerve 1, which is the olfactory nerve, to test your smell, your sense of smell. Could you please close your eyes and occlude one nose and breathe? Occlude the other nose and breathe through it. Okay, now I'm going to give you something to smell, and so you tell me what you smell.
Coffee.
Okay, so from what I've assessed, cranial nerve 1 is intact. Now, moving on to the mouth / throat. I have any difficulty swallowing? Any difficulty eating? Okay. Any trauma to your mouth? Have you had any tonsillectomy?
No.
Okay. So on inspection of her mouth, I see that her mouth, the color is expected. I don't see any cracks, which would indicate dehydration. Everything looks normal with her mouth. Now, could you please say ah and open up for me?
Ah.
Okay. Okay. So from what I assess for her mouth, her buccal mucosa is pink, no enlarged tonsils. Her teeth are intact. Will you please raise your tongue up for me? Okay. Her frenulum is intact. No signs of halitosis. When I checked, her uvula is midline, which is cranial nerves 9. Cranial nerve 9. Her uvula is midline, which means it's intact. Could you please stick out your tongue? move it side to side. Cranial nerve 12 is intact, is the hypoglossal nerve. Now I'm going to, use the tongue depressor at the back of her throat for her to, check her gag reflex. Cranial nerve 10 is intact. Before I move on, I'm going to assess cranial nerve 7, which is the facial nerve. Could you please squint your eyes, puff your cheeks, smile, raise your eyebrows. Okay, from what I've assessed, cranial nerve 7 is intact. Then I'll give you something to taste, because your eyes aren't telling me what it is.
Sweet.
Okay. Cranial nerve 9 is intact as well. Okay. Now moving on to the neck. Have you had any surgeries on your thyroid? Are you having any neck pain? Are you able to move your neck that side? Okay. Now an inspection of her neck. I don't see any discoloration around her neck. No bulges, no masses. And I'm going to palpate her neck. Palpate her thyroid. I don't feel any lumps, no goiter. Then check her trachea. The trachea is midline. I'll give you something to swallow. Swallow for me. Okay, she's able to swallow. Then I would go behind. Could you please turn your head to this side? Okay. Palpating the trachea to make sure that it's not deviating. Turn your head to the other side. Okay. I'm going to assess her trachea is midline. Now I'm going to assess cranial nerve 11, which is spinal accessory nerve. Could you please apply resistance to my hand? Okay. Could you please shrug your shoulders? Okay. So cranial nerve 11 is intact. Before I move on, I just want to make sure that I've assessed all of the cranial nerves. So I assessed cranial 1, cranial 2, 3, 4, 6, 5, 7, 8, 9, 10, 11. Okay. Then I've assessed everything. I'm moving on to
Lymph nodes.
the lymph nodes. Moving on to the lymph nodes. Okay. Pre-auricular, post-auricular, jugular-gastric, occipital, submandibular, segmental, posterior cervical, superficial cervical, deep cervical, super clavicular. I didn't feel any nodules, no lumps. Everything looks normal. Now moving on to respiratory. An inspection of her chest. I don't see any discoloration around her chest. Skin color on her chest suspected. Inspecting her AP diameter. I don't see any barrel chest.
Is it 1 to 2?
It's 1 to 2. Her breathing is normal. She's not using any of accessory muscles to breathe. Now, before I move on, you already said you don't have any difficulty breathing. Have you had any lung cancer in the past? Any family history of lung cancer?
No.
Okay. Now I'm going to auscultate her breath sounds.
You forgot the auscultate. Check for bruise on your carotid. Palpate it, and that's it. You could go back up and then
Okay.
just remember. You know what I mean? Yeah. Palpate your
Before I
carotid.
move on, I'm going to auscultate your carotid to make sure I don't have any bruise.
With the valve.
Okay. I don't hear any bruise, so that's normal. I'm moving on to auscultate your breath sounds. breath sounds are clear. Now I'm going to go behind to auscultate the breath sounds. Can you please breathe in and breathe out for me? Okay. Breathe in, breathe out. Breathe in. Breathe out. Okay, clear breath sounds heard bilaterally, both anteriorly and posteriorly. Now I'm going to percuss. Okay, and before I move on, I'll check check tactile parameters. Could you please say 99?
99, 99, 99, 99.
Okay, then I'll check her thorax expansion. Could you please breathe in and out for me? Okay, and before I move on, I'll just check her CVA. Do you feel any tenderness? Any tenderness? Now, moving on, I'm going to assess her heart. Any chest pain? Any cardiovascular problems? Any family history of cardiovascular problems?
No.
Okay. Now I'm going to listen to her heart.
You can say it out loud. Yeah, already say say what you know. You can say it.
Listening to the aortic, pulmonic, Erb's point, tricuspid, mitral, and then apical. As one as to sounds heard, I don't hear any murmurs. Everything's pretty normal. Now moving on to the breast. Any history of breast cancer?
Well, my mother had breast cancer.
Okay. Have you noticed any changes in your breasts lately?
Mm-mm.
Okay.
Do you perform
Do you perform breast self-examination?
No.
Okay.
Last menstrual period.
When was your last menstrual cycle? The first day of your last menstrual cycle?
It was April 28th.
Okay. Now, I'm first going to inspect the breast, making sure that it's checking the symmetry, making sure that there's no discoloration around the breast, no dimpling of the breast, her nipples are not inverted, making sure that her breasts look even or not too, uneven. Now, could you please lie down? Could you please put your hands over? Going to start from the tail of Spence to palpate the breast. Okay, using a circular motion. Okay, before I move on, I'll squeeze the nipple. I don't see any discharge. Just put your hands over your head. Palpating. now, my assessments, I don't see any discharge, no masses, no lumps. Okay. Now moving on to the abdomen. When was the last time you had a bowel movement?
This morning.
Okay, any abdominal pain?
No.
Any family history of abdominal pain?
No.
Okay. Now, moving on to inspection. An inspection of her abdomen. Her abdomen is flat, not distended. Her umbilicus is midline. It's not everted. The skin around her abdomen is expected. No discoloration around the abdomen. Now I will auscultate the 4 quadrants. Listening for at least a minute.
And if you hear no sounds or abnormal sounds, you're gonna listen for 5, right?
Oh yeah, they were.
Okay, in all quadrants, it's normal active. Now, then I'm going to percuss around the abdomen. I'm gonna assess timpani with head throughout. I didn't hear any dullness. Now I'm going to palpate her abdomen, starting with light palpation. Do you feel any tenderness? Any pain, any tenderness?
No.
Feel any pain or tenderness?
No.
Okay, moving on to moderate or deep palpation. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Y'all good?
Mm-hmm.